What is the proper way to hold a stethoscope during auscultation? Have you ever wondered how to properly hold a stethoscope during auscultation? This technique is essential for accurate blood pressure monitoring, especially when managing hypertension. Let's break it down step by step. First, start with the earpieces. Place them in your ears with the tips facing towards your nose. This positioning allows sound waves to travel directly into your ears without any blockage. It's a small detail, but it makes a big difference in sound quality. Next, let's talk about the stethoscope tube. Hold the tube in your dominant hand and keep it straight. Avoid twisting the tube, as this can restrict airflow and reduce sound clarity. A straight tube ensures that you hear the sounds clearly. Now consider the diaphragm and bell of the stethoscope. For most situations, you will want to use the diaphragm, which is the larger side. It is designed for higher frequency sounds like heartbeats and breathing. If you need to listen for lower frequency sounds, such as murmurs, switch to the bell side. When you place the stethoscope on the patient, make sure it is directly on their skin. Avoid placing it over clothing, as this can interfere with sound quality. Direct skin contact minimizes external noise and enhances clarity. Pressure is another important factor. Apply gentle pressure with the stethoscope. Too much pressure can distort the sounds you are trying to hear, while too little might not capture them effectively. Finding the right balance is key. In the context of hypertension management, accurate auscultation is vital. It helps in monitoring blood pressure and identifying heart sounds. Proper handling of the stethoscope allows healthcare professionals to detect subtle changes in heart rhythms or murmurs that might indicate cardiovascular issues related to hypertension. By following these steps, you can ensure accurate and reliable auscultation results. Remember, the way you hold and position the stethoscope can significantly impact the quality of the sounds you hear. So next time you are monitoring blood pressure, keep these tips in mind for the best results.